What is the Medical Examiner's Office and what does it do?
It stems back to the Harold Shipman inquiry and Lucy Letby.
Have you seen any changes in that time in sort of the NHS culture and the way it deals with mortality and patient deaths?
They need to be seen that they are willing to learn from things that go wrong.
Because I think sometimes families might think, well, if somebody's looking at this independently, it must be because somebody did something wrong.
Most people, they don't know the process.
Hello, and welcome to today's episode of Medical Negligence Matters. Today we're going to be looking at the role of the medical examiner. And with me to talk about this is Sharon Goodwin, who I have known for many years because she worked with Gadsby Wicks as a nurse advisor. But her current role is as lead clinical medical examiner's officer for Mid and South Essex. So Sharon, welcome and thank you for joining me today.
Pleasure. Lovely to see you again.
First of all, for people who aren't familiar with the role, what is the Medical Examiner's Office and what does it do?
Well, the Medical Examiner's Office was brought in to scrutinise all non-coronal deaths. So
what deaths that aren't referred to the coroner?
Which is most deaths in reality. Prior to it becoming statutory, which was only last year for all deaths, it was established in hospitals in 2018. So medical examiners were introduced to scrutinise all hospital deaths back in 2018.
And what was the reasoning behind that?
The reasoning behind it was it stems back to the Harold Shipman inquiry and Lucy Letby, and the death certification process hadn't been reformed for years. So they worked in conjunction with the Coroners and Justices Act.
So there was some concern about whether or not causes of death that were being recorded on death certificates were correct?
That's right. They were correct. They were accurate and appropriate. So this medical examiner's service was brought into being to carry out a proportionate review of the medical records, looking at what the records said and what the causes of death that were being suggested by the treating practitioners are. So they look at the cause of death proposed, they look at the medical records and they make sure that they tally and they are sort of in alignment with each other.
So how does the process actually work? I mean, from the beginning.
A medical examiner is a senior independent doctor that's not been involved in any of the care or treatment of the deceased in life. So they carry out that proportionate review of the medical records. They look at what the treating doctors are proposing as the cause of death, and they speak to the attending practitioners, and they will have a discussion with the attending practitioners to ensure that everything is as transparent and clear as possible.
And how does the family get involved in the process? I mean, are they notified at the outset that the Medical Examiner's Office is looking at it?
The bereavement office make contact with the deceased family whenever somebody passes away in hospital. And they are informed that the case is going to be reviewed by the medical examiner, and that a medical examiner officer will be in touch with them once that review is complete. They will go through what is going to be recorded on that medical certificate of cause of death, and they will explain it to them if they don't understand it, and they will ask that family member if they have any concerns regarding any of the care or treatment that their loved one received, and they will take that on board and they will give an explanation as to why what's recorded on there is accurate and appropriate, and what the medical examiner's thinking was and what the treating doctors have suggested, and they will give them a full explanation. And for most of the deceased's families, they are very appreciative of that explanation. Sometimes there's things on there they didn't know was going on. And it just makes the process a little bit more transparent and clear for families in order to perhaps start the grieving process and understand why their loved one died.
Now, Sharon, you made the move from working for many years within a legal practice and helping with case screening and advising people who believed they had medical negligence claims. And obviously your new role is a bit different from that. And what inspired you to make the shift?
So I felt with the clinical knowledge that I had gained as a nurse, and then the clinical knowledge that I'd gained at Gadsby Wicks from various experts, taking histories from clients over the telephone as to what's happened to them through the medical system and what they feel had gone wrong, and knowing from a legal point of view what happens. I felt that all of that knowledge that I'd gained at Gadsby Wicks put me in a strong position to be able to clinically analyse things from medical records, collate and pick out from those records what might be important.
So it's sort of progression of the use of your skills, really.
I felt that it was a service that, rather than the reactive line of inquiry that the legal profession looks at everything with hindsight, it would help perhaps be a more proactive way of looking at things, helping the bereaved families come to terms with what happens and being able to give an explanation as to why they happened, and not that anybody is necessarily to blame or at fault, and help them have an understanding to move on with that, and perhaps be more proactive in bringing concerns to the forum of referring for clinical governance reviews and to learn from what's happened to help things. That's
a really interesting point, actually, isn't it? Because I know that many of the clients who come to us are concerned not only about the injury they've suffered and possibly getting compensation for that, but are interested in learning, or the medical professionals learning from what's happened and avoiding the same thing happening again. And do you think that this sort of scrutiny process that you've been talking about helps with that?
Yes, I feel it makes the whole process more transparent, and I would hope that it promotes trust in people, that the medical profession does want to learn from what has happened.
And how does that learning work in practice? You know, I mean, how do you feel that the information that's gathered from statistics or information about deaths? I mean, how is that sort of promulgated and
We have sort of learning from death forums, and they have learning from death review meetings on a regular basis, and they look at things that have perhaps not gone as well as they would have expected or as they would have thought they should, and they do try and put in systems and processes to try and prevent them from happening again.
And how does the medical examiner's office sort of work in conjunction with the coroner's office? I mean, they're two different things, aren't they?
Yes. I mean, prior to September 2024, so last year, when all deaths, including community deaths, now have to be reviewed if they are not falling under a coronal investigation. Prior to that, the treating doctors would just write the certificates and they would not be independently scrutinised.
So, there was no independent assessment of the process at all. And not all deaths were referred to the coroner, were they? I mean, really only quite a small number of deaths would be recorded to the coroner.
Very small percentage are referred to the coroner. The coroner will only investigate really what are unnatural deaths. Prior to that, natural deaths were not independently looked at. It was down to the treating doctors, physicians.
So there's quite a lot of important information that could have been lost there. And hopefully that is now being picked up.
independent.
You must spend a lot of your working life dealing with families who have been very recently bereaved, and that must be quite difficult.
It's hard. I mean, obviously, I speak to bereaved families every single day, and I think it's very important to have empathy and actively listen. And the whole process was designed to give bereaved families a voice so that they have a chance to talk about their concerns and are listened to and have an explanation as to why things happen. And that is a very important part of our role that we carry out every single day.
What is it that particularly motivates you to do the work that you do?
I think I just enjoy, or enjoy is probably the wrong word, but I get a lot of satisfaction out of being able to give an explanation to people, helping them understand the process. I've suffered a few family bereavements myself in the last few years, and I think it's an area that people find really hard to talk about.
Of course, it's a very emotional time, isn't it, anyway? And I think sometimes trying to negotiate the administration around death is hard.
After the event, sometimes it's harder to talk about it. They don't know where to go. So if we can give them that opportunity, give them that chance to air any concerns, we can signpost them to the right places so that they can get that support and help that they need, and hopefully just allay some of their fears. A lot of people, when they've lost somebody, carry a lot of guilt that they could have done something different. So we do help allay that because it's been independently looked at, it's been scrutinised by a medical examiner, and they're getting an explanation as to why their loved ones passed away. So I think it can help with their grieving process.
And do you think, are there any sort of misconceptions, misunderstandings amongst members of the public as to what the medical examiner's officer is and what it does? Or
yeah, I think television has played a role in that. A lot of people think as a medical examiner you're able to carry out postmortems. Medical examiners are not able to carry out postmortems. They think the medical examiners are part of the treating team. They're not. They are doctors that for that session that they're carrying out the work for the medical examiner's service, they are working independently. They are senior doctors and they have to have done some additional training in.
But they're nothing to do with the treating team that have been involved in the care of individual patients. And do you have you encountered sort of situations where you feel that what you do has sort of helped a family to understand more about a death?
I think every day, from the feedback we get on the telephone when we've gone through those causes, we've explained what they mean, because often the causes of death are recorded in a legal language, and not everybody understands those legal terms.
So you can translate those.
Those for people. So I think just to give them an understanding, the feedback we get on the telephones from the people we speak to every day gives us that knowledge that we are helping them on the sort of grieving process. And we also explain the next steps, that, you know, when they need to ring registration services, they need to obtain the official certificates, and they need green forms to give to their funeral directors. Most people, they don't know the process of what to do when somebody passes away. So we can just pass on general administrative information as well as to what comes next.
And I imagine that some of the families that you speak to obviously must start out, apart from being obviously very upset, but also very angry. And do you have experience of what you have done being able to sort of dissipate some of that and help resolve things for families?
I think just having somebody listen to their concerns and actually acknowledge that they're not being silly, they're not unjustified, and that it's having somebody that asks that in an open way, because obviously most people will just want to say what the cause of death is or not even talk about the fact that somebody's died. But we give them an opportunity right at the early onset of the grieving process to actually air their concerns. We directly ask them if they've got any issues, any questions, anything that they want to talk about.
How do you explain to families that review doesn't always mean that there's fault? Because I think sometimes families might think, well, if somebody's looking at this independently, it must be because somebody did something wrong.
I think we try and explain to them that the independent review has come about because of cases like Harold Shipman, which is obviously an extreme end of the spectrum. So we explain to them that the process is to really ensure that nothing has gone wrong, and that medical examiner has reviewed the records. They have looked at what the treating doctor has proposed as the cause of death, and actually it is in alignment with everything that they've read. So it's to give them reassurance that actually nothing has gone wrong.
And that if something has gone wrong, then it will be looked at properly and hopefully steps taken.
And obviously, So
overall it's a positive, hopefully,
and to reassure them that if there was anything that was wrong, it would have been picked up by the independent medical examiner, and appropriate steps would have been taken to refer that to the correct procedure to be having looked at further and more independently scrutinised.
And have you seen, I mean, obviously you've been in your current role a relatively short time, but have you seen any changes in that time in sort of the NHS culture and the way it deals with mortality and patient deaths?
They are trying to put a much more emphasis on learning from patient deaths. So I think there is a culture that's encouraging the NHS as a whole to learn from people's experience and to try to make the whole process better. And it's a difficult time for relatives, obviously, and people want to, it sounds like a funny term, but you want people to have had a good death because ultimately it's part of life, and you want that end to be as seamless and as pain-free as possible. And we want to reassure people that we're going to learn from things that go wrong to try and make that process as seamless and as painless as possible.
And do you think the system, I mean, you've talked quite a lot about sort of transparency, and do you think that there is much more willingness within the system now to be open and transparent about the circumstances?
I think with all investigations, the NHS now is with the openness and want to be. They need to be seen that they are willing to learn from things that go wrong.
Yes, I mean, there's been a lot of scandals about the NHS, haven't there, in sort of recent years, and I think there might be a feeling that there's still this idea of closing ranks and not talking about it. But do you think actually you're at the coalface? I mean, do you think that there is more of a movement towards openness and transparency and an acceptance of that?
Yes. Yeah, I think that's what the service is really all about, is having that. Obviously, we deal with the end of life part of that process, and that is what the medical examiner service is all about.
As I said, it's sort of early days for you in the role, but how do you sort of see it evolving in the future? I mean, what do you want to achieve within the role, and where would you hope that it would go?
I think that we hope that it will just become more streamlined. It will become more accepted. It is very early days at the moment, and it's very much seen at, I think, that it's causing a delay in registration and the process, but hopefully people will in the future see that it is there and does serve a purpose, in that it means that they can be reassured that their loved one has received the correct treatment and the correct care for the end, and that there is nothing untoward or sinister or anything that has gone on.
Well, Sharon, thank you so much. I mean, we've dealt today with a subject which is a very, very emotive and very difficult, but I'm very grateful to you for giving us the information you have today about Medical Examiner's Office.
Thank you.